Hi, this is Diane Carbo, RN of caregiverrelief.com. Today's topic is what stage of dementia is sundowning occurring? I want to make my listeners aware that there are many different types of dementia, and they all have predictable stages. Not all individuals with dementia will develop sundowner syndrome. So, at what stage of dementia does sundowning start? The symptoms and stages of dementia progress in a predictable manner. But as I have said before, every case of dementia is different. Patients that have symptoms that worsen as the day goes on, especially as the sun goes down, is known as sundowner syndrome. Sundowner syndrome is not clearly understood. There are, however, specific symptoms to look out for and simple approaches to decrease the behaviors. So, exactly what is sundowning? Sundowning occurs when a person's mood, personality, or behavior changes in the late afternoon or early evening occur. Doctors are unsure why this happens, but it affects roughly 1 in every 5 dementia patients. Scientists believe the chemical changes that occur in the brain with dementia affect the patient's internal clock, the circadian rhythm, if you will, causing the part of the brain that signals when you are awake or sleeping to malfunction. The sun goes down, low light, symptoms of depression and boredom, pain and sleep problems are all thought to contribute to setting it off. The mental and behavioral symptoms a person with dementia exhibits worsen when a patient is sundowning. Those suffering with sundowner syndrome may follow their family caregiver around like a shadow and even mimic your movements. They may ask the same questions over and over again, forgetting your response, even forgetting that they asked the question. There are some that temporarily lose their ability to communicate. Some patients become extremely restless, agitated. They will pace for hours. Some may even try to leave the house and wander aimlessly. Let's discuss sundowner syndrome. Common symptoms. Early symptoms can be very subtle, inconsistent, and difficult to detect. Many patients become demanding, restless, and agitated. They become irritable. Confusion and disorientation grows as the day goes on. They become suspicious of others, making false accusations. These symptoms become more pronounced and regular as the condition progresses. Sundowning symptoms typically peak in the late afternoon and can last well into the night. Here are some common symptoms of sundowning: anger, depression, anxiety, agitation to the extreme. People show fear. They have delusions, which are beliefs. They have outbursts of emotion. They become paranoid. They have hallucinations. They see things that aren't there. Maybe crying, pacing versus wandering, restlessness, rocking, and they have sleep problems. I can tell you, you'll know when somebody's sundowning. In fact, I have seen it in dogs. It's true. Doggy dementia is very real too, you guys. When you see somebody with dementia, and I've seen it often, you can just see as the day goes on, they become so restless, so anxious. Pacing is very real, and they just don't know where they're going, what they're doing, what they want, and they become irritable and cranky, to say the least. The onset of symptoms and individual behaviors will vary patient to patient, and the symptoms frequently interfere with sleep. Sleep deprivation can cause recurrent episodes of sundowning. That leads to the next question. What does cause sundowner syndrome? Studies reveal up to 20% of dementia patients experience worsening confusion, agitation, and anxiety in the afternoon or evening. As I said before, doctors do not fully understand sundowner syndromes or its underlying causes. There are some potential triggers that have been identified. Contributing factors can include sensory overload or sensory deprivation. It could be too much light, too little light, too much noise, the wrong kind of noise. They watch the news, it upsets them, it makes them angry. Unmet physical requirements. They might be hungry, they're tired, maybe they have pain. Mobility issues can contribute. Social isolation, increased stress. Here's a point I want to make about stress to a person with dementia. Remember, are living in the moment. They truly lost their past and they can't look to the future. So they truly are living in the moment. So when they are stressed, it may be picking up your feelings or the others in the room, their feelings, and that increases their stress. Many develop a decreased sense of security, where they have a fear of danger. They become anxious, apprehension, or their unfamiliar surroundings may set it off. Or they have had an unexpected change in their routine can set them off. And of course, sleep deprivation and circadian rhythm disruption is tough. I can tell you, I've heard patients. I had this one little lady, her name was Mary, and she sundowned every day. And it was we struggled because she always would say, help me, as the even afternoon and evening went on. And then when you went to help her, she would scream blue bloody murder and say that we were harming her in some way. It's very real and it's very hard to deal with. So how do we treat sundowner syndrome? The first step in treating and managing sundowning symptoms is to confirm that it's sundowner syndromes and not a condition known as delirium. Delirium is a medical disorder that causes mental confusion as well as changes in attention span, perception, mood, and a level of activity. People with dementia are predisposed to developing delirium. The best way to tell if your family member has delirium versus sundowner syndrome is to pay attention to the timing of their behaviors and when they occur. Delirium is a condition that develops quickly over days or weeks rather than months or years. The associated confusion and behaviors fluctuate throughout the day rather than in a predictable late afternoon or early evening pattern. Now let's discuss how to manage a family member that is sundowning. There are steps you can take to both prevent and manage sundowner syndrome. The most important thing to remember is patience is a virtue. When you are caring for somebody with dementia, you're definitely going to be challenged. Dementia patients, as they decline, lose memories. They have lost the ability to remember the past or think about the future. They live in the here and now, as I said before, and they will pick up on your feelings. So it's really important that you be aware of your emotions. Feeling frustrated or angry will be picked up by your family member with dementia. And remember, they've lost their ability to reason. So put your frustrations aside, take whatever steps necessary to reduce the triggers and behaviors of sundowning. Here are some simple tips for dealing with sundowning. Maintain a calm demeanor. Learn to take deep breaths. Avoid raising your voice or making any sudden movements. In order to identify any unmet needs, try to ask questions. Avoid asking them to explain things that do not make sense to you. Keep the curtains closed throughout the day. This is to prevent any changes in light from triggering an episode. Adequate lighting can decrease the anxiety that occurs as the sun goes down. In the afternoon and evening, provide a peaceful, calm environment with few distractions. I suggest that you keep the TV off, definitely avoid the news, and instead consider putting on some calming music. If you have a family member that has a love of music and they have a type of music they enjoy, whether it be gospel music or jazz. Put that on and see if they enjoy that. Keep your family member with dementia active and busy during the day. This is to increase the chances that they may be tired enough to sleep at night. Try to prevent them from taking long naps, especially in the afternoon. Develop a daily routine and stick to it. This will help your family members stay on track and reduce anxiety. In the afternoon and evening, engage in relaxing activities such as watching a movie, listening to music, playing cards, or folding laundry, whatever it is that they need to do to keep busy. It may be that they want to just clean. Let them clean something for hours if they want to. It's okay. It's important to keep them busy and happy. You may want to consult with your doctor about potential medications that could help with various symptoms. Sundowning medication may include anti-anxiety and hypnotics, and I will recommend that you consider medications as a last resort. The medication ordered by your doctor may have the opposite response you want. I've seen it so many times. It's called a paradoxical effect. Medications made to sedate and calm in some can cause increased anxiety and agitation in others. So if you do decide to introduce medication, start at the smallest possible dose, then increase until the desired response is accomplished. I do recommend also exploring non-pharmacological options, such as light, music, massage, and aromatherapies. See what works for your family member. Some of the results will likely vary and may or may not alleviate symptoms. Research indicates that sundowning often occurs during the middle or late stages of dementia. For those wondering at what stage of dementia does sundowning occur. With this information, I hope that caregivers will be better prepared to deal with the family member that suffers from sundowning. I'm Diane Carbo, RN with caregiverrelief.com. If you're a family caregiver, remember, you are the most important part of the caregiving equation. Without you, it all falls apart. So please practice self-care every day. Learn to be gentle with yourself because you are worth it.